New videos every day.
So you may know that I am in graduate school right now, and I am doing an internship to become a registered dietitian. And with that comes the requirement to do an internship. And I'm on the last leg of it. I'm doing my clinical rotation right now. So I'm at a hospital near where I live. And it's so interesting. It's very eye-opening to be working in that type of environment. And I just wanted to share some of the things with you that I've seen. And they're not necessarily patients that I've been treating, but when you hang out for a while in a hospital, and if you're young, you may not have had that opportunity. And yes, I call it an opportunity because it can be a very big motivator for you to change your own life. But if you haven't been in a hospital, it's sometimes that infallible sense that you have that, you could never die and that your life will never end, that can come to a halt when you see some things that go on in the hospitals. So one of the main things that I've seen is that there are too many young people in the hospital, younger than that they should be. And the most of the patients that I've become familiar with have preventable conditions. And it's just very shocking. I mean, I know that, and I do videos about preventative lifestyles and changing and improving your diet and being healthy. But when you see someone in their 40s, or when you see someone in their 30s, or when you see someone in their 20s, in the hospital, coming back to the hospital over and over because they're not changing their diet, or they're not improving their lifestyle, or they're chronic alcoholics, or they're regardless of what it is, it's so eye-opening, and it is such a motivation because, I don't want to be in the hospital at 35 or at 45 or feel like my life's about to end and I'm on my deathbed because I made some bad choices. Some of the people that are in there, of course, have diseases that aren't because of a choice that they've made, or aren't because of lifestyle choices that they've made. But I get to see all kinds of different things. Of course, the hospital that I'm at has an oncology floor, so I see cancer patients, and I see diabetic patients, and I see kidney transplant patients, and and it's just really fascinating. But the thing that has so struck me is that there are so many people that are in there and they don't have to be. And my goal of just to kind of share this with you is I don't want you to wait until some traumatic event happens. I don't want you to wait until your organs start to fail. I don't want you to wait until a family member dies before you become passionate about health. Sometimes there's not a whole lot I can do, because if they're at the end of their cancer treatments and it's not working, or if they've gotten some transplants and their body's rejecting the transplants. So there's different scenarios where, I still see the patients and I still do what I'm supposed to do, but sometimes it's not effective and there's not a whole lot you can do kind of once you get past a certain point. Just to give you some examples, there's a 44-year-old person in the hospital, and they are very overweight, possibly even morbidly obese, and they have diabetes. And one of the complications with diabetes is kidney damage, which is called nephropathy. And so this individual has kidney damage, and they're on a waiting list for a kidney transplant. And right now they're in acute renal failure, which means that their kidneys are not able to clear out the bloodstream of certain byproducts of protein. And so basically, if that person does not get the kidney transplant in time, and if we're not able to regulate those different lab tests that we're monitoring, this person can die. And so that's an individual that may or may not improve. So it's very dependent. Another person that just received a pancreas transplant, and their body rejected the pancreas transplant. And sometimes you can get another organ. Sometimes you're on the waiting list and you don't get it. So sometimes it's just hit and miss. So these are just some things that I've kind of been working with and some people I've been seeing. But what's very interesting is that there are so many people that are in the hospital, and it's really before their time. They're young. They should be living life. They should be, going full steam ahead, enjoying their lives, and yet they're in the hospital and maybe even approaching death prematurely because of the choices that they've made. And I want to impart to you that it's your choice. A lot of, with most of the people that I've been seeing, they can make such a difference in their own prognosis, in their own, health, just based on the choices that they make. Diet, lifestyle, exercise, reducing their stress. What's really sad is one of the floors that is the most heart-wrenching that I go on is the oncology floor. And some of the patients will come back from the cancer. Some of them will do really well and will, start incorporating more vegetables and start incorporating more lifestyle choices and diet that actually will help to heal them after cancer. And some of the cancers are preventable, and yet people are in the hospital because of the choices that they've made. Now, some of the cancers, we don't know, why they got them or how they got them or really how to treat it. But a lot of the patients that are in there, they have chosen really their own fate based on the choices that they've made, particularly with their diet. I just don't want you to wait that long. And, I'm at the hospital right now doing my rotation, but what I'm real passionate about is helping you before you get to the hospital, helping you be preventative and be proactive and make those right choices and be healthy so that you don't have to be in the hospital and you don't have to keep going back to the hospital because it's so gut-wrenching. And it's very disheartening when someone's in the hospital and they may not make it. So I just want to leave with you that don't wait until something tragic happens before you decide that health is important.